Listen. Can you hear it? There's something thumping in your chest. Yes, folks, this is your beating heart. And to keep beating, it needs a healthy supply of blood flowing through the cardiac piping so that the heart muscle has enough nutrients to keep beating. However, there's a disease that can cause thickening and hardening of the arterial wall that can restrict or reduce blood flow, and the heart struggles to beat. So we need to open up these arteries, keep them open, and potentially deliver a therapy to the site of disease to prevent the condition returning. So what do we do? Fortunately, teams of engineers, scientists, and clinicians have been working on solutions for the past few decades to invent solutions for improving quality of life for patients and delivering therapy. So through the combination of engineering design, material science, and precision manufacturing, this has led to the development of a device that can revolutionize treatments for patients. So this is what's known as a stent. So imagine a tiny scale cylindrical mesh, or better yet, a tiny tube of chicken wire, except the wire is on the average diameter of 100 microns. That's the diameter of a single strand of human hair. And these devices are amazing. They act as scaffolding, holding the artery open. They were originally bare metal, but now we have versions that are drug-eluting, delivering therapy directly to the site of the diseased arterial wall. And they are designed to last a minimum of 10 years in the body. And did you know that approximately 2 million of these devices are implanted all over the world every year? And did you know 4 out of 5 of these devices are made right here in Ireland? However, not every patient with this condition can receive a stent, so challenges remain. New devices are emerging onto the market, and with this, we have more challenging anatomies and different blockage types to be treated. So with these new emerging devices, we need new tests, new guidelines to above all ensure patient safety and device efficacy to make sure they're fit for use. So part of my research is to design virtual and physical tests so that ultimately our hearts keep beating.
Much clever.